already mixed. Usually 30 minutes they melt already. 하나 좀 껍데기 까서.
How many cc?
저거 껍데기 까서. Okay, this is the 200 milligram. Before we mix with sterile distilled water, 3 cc, and 1 cc lidocaine with the epinephrine. So total 4 cc. If you want a little bit loose, then you can still make a 5 cc, 4 cc with the sterile distilled water, 1 cc with the lidocaine with the epinephrine. They melt in 30 minutes. Okay. So after 30 minutes, they will become like this. How many cc? Huh? 4? Okay. Okay, so before you use, shake it. And it's so simple. Lidocaine with the epinephrine. The entry point, 1 centimeter lateral from the lateral canthus, and then 1 centimeter down. So this will be your entry point. And the other one, from tragus, 1, 2, 3. And then from there you go, or because this area, then you consider about the length of the cannula. So this will be your entry point. Here again, 1 cc, 1 centimeter, 1 centimeter down. So this will be your entry point. A little bit lower. Okay, and here, this will be your entry point. Puncture and betadine and ginidapine. 22. Oh, it's a yellow. What's this yellow?
洗傷後嗰啲係咪？
Okay, puncture. Puncture. Give me the pillar. Shake. Shake. Please do not withdraw it first and then be ready and then put it on the table. Before you use, you withdraw right away. Okay, you shake it, withdraw right away. 1. And then you put the cannula, blunt cannula, 21G. And then okay, sorry. You go up to this area. If you want to improve dark circle, you have to cover all this area, okay? So shoot slowly. Shoot slowly. You shoot about 0.3 cc if you want to improve the dark circle. Okay? And then the rest of them, you spread around this area. So she will have a brighter and more lifting effect naturally. Okay, so it's so easy. You go in, withdraw, you go in, withdraw. Okay? Okay, finish. Don't make bubble, okay? All the bubble. That's why it's difficult to give me. Hold it. Put it. You know, if you make bubble here like this, there will be leak, a lot of leak, okay? So you should, when you do it, you go this way, and here, yeah, something like this. Don't make bubble, okay? Okay, get one more. So here, where's the puncture? Okay, and then I will tell you the secret how to make more collagen stimulation. If you go inside, let's say, when you put the filler here, something like this, did you find something like an empty filling inside? Right? So you put the filler there. What happened? I tell you, you are in the wrong layer. The filler will disappear more faster. Especially this is, I told you, collagen stimulating. Where do I throw? Here? Collagen stimulating material. So how you going to put it is, please, something like this. You scratch. You scratch the skin surface. Okay, just like this. You scratch. After that, you put. Okay, it's totally different. If you go deeper inside like this, it's so empty, you see? You can see, huh? It's like empty space. If you put something there, usually no effect. So, you go just like this, scratch a little bit, and you shoot. Then you will see a lot better effect with this collagen stimulator. So that's why when you put like a Sculptra with a needle, something like this, I tell you, it's not really effective. I just feel sayang, wasting of the filler. See, you scratch it like this, you give a scratch, and you shoot. Then you will have a better effect, okay? Where's the cover? The other side, function. So you see, shooting this filler, even not more than 5 minutes, okay? It finished very quickly. Do you know why it's important? You should have this kind of things in your clinic, because for your economical purpose, you finish one patient in 5 to 10 minutes, then you go to another patient, another 5 to 10 minutes. But you hold one patient for 30 minutes, 1 hour. Actually, that is not very profitable for you, okay? It's already getting better. You will see a lot improved dark circle, okay? You will hardly find something get improved the dark circle, okay? But this PDO powder is fantastic. Sorry. So, puncture. I tell you also, give you one tip, because I've been training a lot of world famous doctors came to my clinic even last week. You know, when you make a puncture, usually you do this way, you know? You puncture this way. This is very wrong. When you make a puncture, if you're going this way, also puncture also come from this way. And then make a good clean puncture. Okay? So even the puncture for the cannula is very important. Because I saw many people, we had 9 doctors from Singapore training in my clinic. They puncture this way, and then the cannula difficult to go in. Okay, so even the puncture is very important. Make a bevel down. Okay, here again. Don't be afraid. 21 gauge will never puncture any blood vessel or any cause of necrosis. So here, look at the speed, okay? Slow, gentle, even speed is very important, okay? So go in, another slow, gentle shooting. Another one here. Okay, so here, another one. Here, you go, look. Blue. So stiff. New one. Thank you. Better bank. Here, one more. Okay, so please remember, scratch, 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 and then shoot, scratch, and then shoot, scratch, and then shoot. One thing, just in case, this one also can lift the volume a little bit, but minimal amount. So let's say someone who has a sunken area here, then that one you don't need to scratch, just shoot it. So this area, if you scratch it and you shoot it, this area becomes something like this. But the sunken area here, don't scratch it, just shoot it, still okay. Okay, so we are done. Very simple and easy. She will improve the dark circle. She will tell you her skin becomes super bright. And after 1 month, 2 months, she will see the lifting, tightening, all come together. You can repeat after 2 months or 3 months.